You're watching the Valley's most watched television station, WKBN 27.
Welcome back for our Live at 5 segment. Joining us today, Dr. Michael Sevilla from Salem Community Hospital. We're talking about breast cancer awareness. We want to make sure that people know the facts about this disease because it's a scary thing, but there are a lot of things that you can do to minimize your risk and certainly to catch it early.
Sure. Yeah, in fact, coming up in October is National Breast Cancer Awareness Month, and some interesting facts that I found during my research is about 184,000 women are diagnosed nationally every year.
Wow.
And about 40,000 deaths result from breast cancer. And the statistics right now say that about a lifetime chance of getting breast cancer is 1 in 8.
That's very low. I mean, that seems like it would be, or it's high, I guess, depending on how you look at it. But it seems kind of, daunting when you think about it. So who's most at risk?
Some interesting things about risk factors is that people always talk about family history, but when you look at the current statistics, in people with breast cancer, there's only about a 20% patients only report 20% family history of breast cancer.
So the other 80% don't have a family history, at least that they know of.
That's correct.
And how far back does it go generally, that to count when you think about having a history? Is it just a mother or a grandmother, or can it go beyond that?
Yeah, the most important is first generation, whether it's a mother or even a sister, but anybody with a family history, even grandmothers, great grandmothers as well. Another question I get too is that birth control pills, are they associated with breast cancer? The studies are conflicting. Some say yes, some say no. So when people ask me about that, I say there's not really a definite risk that we can prove at this point.
So just want to make sure to talk with your doctor, and
exactly.
make the decision that's right for you.
Another question I always also get is, are there certain vitamins or is there a certain diet that can prevent me from getting breast cancer? There's been a lot of studies on that as well. There's no definite link between this vitamin or that diet to say, yes, you definitely won't get breast cancer. Something that we do know is that exercise does decrease your risk of breast cancer.
And also, of course, you need to know, whether or not you have a family history of it, and of course, you want to get checked regularly so that you can catch it early if it does become, a problem.
Exactly. Yeah. The most important thing is to visit with your doctor and to talk about your risk factors. Everybody's very familiar with the mammogram. The most state-of-the-art thing right now is called the digital mammogram, which is offered at Salem Community Hospital. What we found there is that you can get digital images of breast tissue, and what we found is in some cases we've been able to detect breast cancer earlier and treat it. Now, is that going to be the standard of care over the traditional film mammogram? We're not really sure of that yet.
When do you start needing to get a mammogram?
Yeah, that's a very good question. I get that a lot, and when you look at some organizations' recommendations, everybody agrees on age 50. But if you do have some risk factors, it would be good to talk to your doctor about maybe getting your annual mammograms earlier than that. The most important thing is to know your risk factors, and the best way to do that is to visit with your doctor, get your physical exam done, and kind of know what your risk factors are.
All right, doctor, thank you very much. We appreciate your insight.
Thank you.
All right, everyone, stay with us. We'll be right back.